Welcome to Sitting with Sallie. Today we're going to talk about naturopathic medicine, and I have with me Chris Brown from Little Oak Wellness Clinic. Welcome, Chris.
Hi, Sally.
And you are a naturopathic doctor.
I am, yes.
And
Feels good to say.
it feels good. I'm sure it does.
Yeah.
Yes, it's naturopath is one of the alternative medicines, if you like, but most people don't know very much about it.
Yes, that is a very good point. Yeah, so naturopathic medicine, very new to a lot of people, especially in Kenora. Actually, naturopathic medicine has been in town for quite a number of years. Has actually been an established practice in town for just over 5 years now. And what naturopathic medicine is, like you said, that complementary and alternative medicine style of practice where we primarily focus on treating from a holistic perspective, going at the person. So a lot of our patients come to us and they have asked themselves a simple question: can I be doing more for my health that I'm not currently getting? And we have the answers to that. And we come at it from a naturopathic perspective.
And when you're saying holistic, I often think of medicine as treating symptoms and rather than holistic. Can you just explain what you mean more by holistic?
So yeah, when you're comparing types of treatments for patients, a lot of people, you have to make a decision as a practitioner whether you're a physician or a naturopath or your chiropractor or your physio. Symptom management is obviously a huge priority for patients. We were talking about pain off screen. We'll probably get to that later. But managing pain, a lot of it is symptom management for people. And then what you also want to consider as a practitioner is coming at it from a holistic perspective. And what I mean by that is finding those causes, either they're organic or inorganic, and treating the condition from that perspective as well. So you want to make sure you're not just addressing the symptoms. And naturopaths, it's a big focus for us. Not saying that it wouldn't be a focus for other practitioners, of course, but it's a big thing that we like to focus on in our practices.
And as a holistic way to look at things, I also assume that you're interested in preventative before things start going awry.
Oh, that's our bread and butter, preventative medicine. Yes, so a lot of the conditions that people are dealing with on a day-to-day basis come from a lot of preventative type diseases, and that seems to be a big purveyor, of course, in North America. So helping coach people, or being like a lifestyle coach is sometimes what we're called, is a big part of our job.
And preventative is going to look at bad habits such as smoking, too much alcohol, bad diet habits, I presume.
Mm-hmm. And these are all things that you would get in a traditional like family practice as well. When our style of practice, patients usually will get more time with us. So a big advantage that we like to leverage with our patients is the amount of time you spend working with those relationships and helping build a sustainable model. Like everyone knows, especially all physicians, all naturopaths can talk about quitting smoking until you're blue in the face, like you said. But it's helping set realistic goals over a longer period of time with someone before you can help establish a long-term plan for quitting. Because most people have tried to quit, right? And
Yes.
it's not really.
Yes.
Yeah.
And
so you don't need to just tell them.
No, they've heard it, like you're right, till they're blue in the face.
Yeah.
Diet, I think, is another good thing to think about. Almost everyone I know has been on some diet at some point.
Exactly.
And it may have worked short term, but gone is the diet, gone is the New Year's resolution. So if I come to you and I tell you I want to lose 20 to 30 pounds, and I've tried every diet under the sun, what kind of advice are you going to give me?
That's a great question, and that's a very typical presentation we'll get into the clinic. And it's not about just blindly giving someone something because they've either not tried it before or they haven't. They have tried it, you just didn't tease that out. The important thing is tailoring something to their specific lifestyle, right? So so if you're coming to me wanting to lose 20 to 30 pounds, I'm like, okay, so how's that weight come on over the past few years? What types of things have you changed? Are we having to go at this from a dietary perspective, exercise perspective? Do we have to find some kind of organic cause to the weight gain? So as a primary care provider, as a naturopath primary care provider, our focus is primarily finding, like I said, those reasons the weight came on, and then working with you to come up with a focused plan that works for you more specifically.
And I'm assuming it's not going to be a diet. It's going to be a lifestyle change.
Yes, that's a good way to put it.
And how do you convince people that whatever it is, no more grapefruits?
Right. Well, it's usually not that simple.
No.
Yeah. So that's another good question. So it's not so much convincing someone, more or less getting them on board for something that they already want to do. Now, a lot of the times people don't necessarily come to us saying they want to lose weight, but you know that's a long-term goal of theirs. They'll come to us saying, I have knee pain, oh, I have, I have depression, I have diabetes that I want to control a little bit better. So what you want to do is you want to start off with some simple things that they have no problem implementing. Maybe a few weeks of acupuncture to reduce knee pain, which is quite efficacious. Obviously not making that our long-term goal for pain reduction, because we all know that knee pain will reduce with weight loss. So once you get the person on board with a few treatments of acupuncture or something like that, they're a little bit more invested in the long-term treatment plan, and then you can kind of tease out those long-term goals with them by setting some realistic dietary expectations.
So you have to sneak them onto a diet.
It's not so much sneaking, because this is something that they want help with and they know what they want to do. So it's more about helping them find a way to get there.
It sounds like it's almost like the two of you have to get the patient on board, and then you work out something that's realistic.
Yeah, exactly.
So how did you become a naturopath?
That's a good question. So I went to undergrad at Lakehead University. I studied kinesiology. I loved my science programs. I always knew I wanted to be in the healthcare field, and I knew that becoming a physician wasn't quite the right fit for me, but I was very passionate about becoming a primary healthcare provider. And after doing some soul searching, I didn't really know what direction I wanted to take. There was physio, chiropractics, osteopaths, and I actually didn't even know what a naturopath was until I talked to a counselor about it. And they said, well, it sounds like you want to be a naturopath. And I'm like, well, what is that? Because I was very interested in learning about, nutrition and how it helps the body, and lifestyle changes, how it helps the body. And I was very interested in science. So they said, yeah, look into this. So I set up a meet and greet with the naturopaths in Thunder Bay, and they've been mentors with me the past 4 years, and now I'm here today.
I like that story with saying, you didn't know what a naturopath is, because many people watching today, you may be the first naturopath they have heard speaking about naturopathy.
Yeah, exactly.
Now, you also talked about it being complementary, and you use different kinds of alternative treatments. You mentioned acupuncture. Can you talk about some of the other treatments?
Yeah, for sure. So complementary and alternative medicine shouldn't mean complementary in the fact that it's added but not really necessary. And alternative doesn't mean opposing to. We're not here to kind of take over or replace any type of healthcare services. Naturopathic medicine is really much about boosting someone's health while working in conjunction with everything else. So acupuncture for pain management is very effective with going along other people's treatments. We do botanical medicine, we do physical medicine, we do homeopathy, nutritional therapy, lifestyle treatments, and things like that. A big part of what we do as well is kind of lifestyle counseling, which is a big part of our job.
And of course, each of these are choices you have. Someone isn't going to come in and go through all of them.
Exactly. So you want to think about you as a person, as a practitioner, I should say, and you have your tool belt, right? So every practitioner has a tool belt, and what I pull out of my tool belt to treat with someone is different than, of course, your physician or your physiotherapist. We might have some of the same things, but how we utilize our tool belt is really what comes down to helping you, right? And we're all having the same goal in helping you, but what we utilize is going to be coming from our own different perspectives, right?
We're going to take a short break, but what I liked you talking about earlier is that it's you and the patient working together. And I think often patients don't take on to themselves that they have to actively participate. Mm-hmm. So maybe we can talk about that when we come back.
Sounds good.
Okay, so join us in a few minutes. Welcome back to Sitting with Sallie. I'm talking with Christopher Brown, a naturopathic doctor, and we were talking just before the break about how people aren't necessarily actively involved in their own health care. And I've noticed that a lot of people really would like to take a pill and hope that the pill creates a little miracle, if you like. And medication is wonderful, but often it's only one step.
So, and talking about lifestyle changes, and I think most people have a goal of perceiving themselves as being healthier. And a lot of the people that come into our practice have kind of the same MO when it comes to that. There are barriers to making us healthier, and everyone has barriers, no matter who you are. And I think helping people normalize those barriers and find solutions to them increases their chances of becoming more active in their health investment. Like you said, taking pills is very passive for your health, and oftentimes it is necessary for a lot of conditions. And as a naturopathic doctor, we have to condone treatments that are the best for people's health, but also getting people more actively involved doesn't just mean convincing them of what treatments are best, but being more aware of what is good for them. So helping someone get more involved in their healthcare means making them feel empowered that they're in the driver's seat, right?
Definitely.
Being passive just doesn't mean just, taking whatever advice you're given and following it blindly. So my big part of my job is education. And I love educating people because usually they leave the office feeling more in control of what is happening to them. So once you do that, once you bridge that gap and answer someone's questions, they really feel like they can take control of the situation a little bit more. And falling off the bandwagon, let's just say we're talking about a diet or we're talking about a lifestyle change that involves making some dramatic changes in your busy life that has barriers, falling off the bandwagon is okay. Everyone does it, and it's normal. Helping normalize that for someone so they can continue forward and find out what's more realistic in the moment, right? Like if you're going through a stressful period and you need help kind of adjusting, then we're here to kind of help find that solution for you. And whether or not that's altering the treatment a little bit or coming at it from a different perspective really helps the person feel like they can become more invested, because everyone knows they can be healthier. Well, sorry, that wasn't really a good statement. Well, that wasn't a sentence that made sense.
Everyone knows they can be healthy. Fair enough. I
Yeah.
think we all know. We all know that, drink moderately, don't have too much salt, don't eat red meat, don't eat at the fast food places. We all know those kind of things. We all do them to some extent. I mean, there are probably a few people who really are the pinnacle of their health, but most of us know we could be healthier. I think diabetes is a good example, if you'd like to talk about that, because I know with diabetes, sometimes you can manage it with diet alone, sometimes you can help manage it with metformin, and sometimes you need insulin, but you can always improve the outcome if you make some lifestyle changes.
Absolutely. So the medical literature cannot state it enough that, medication alone should not be the primary treatment for diabetes. And really, patient education in this context of care can make a huge difference on a date for the average person. And having them have that exposure to healthcare providers that can provide that education makes a world of difference for diabetic patients. So putting them, like I was saying, putting them in the driver's seat, making them feel that their diabetes isn't being managed alone by just their medications, really makes a difference for their long-term health. And I feel that when you give someone the power to make choices for their health, when it comes to reducing their weight or managing their blood sugar through diet and exercise, you really improve their long-term outcomes and their perspective on their health care.
And so how do you keep someone motivated? Partly you were saying giving control to them, but what other things will keep someone motivated?
Yeah, so that's not, unfortunately, that's not our job, right? Keeping someone motivated is you have to find their intrinsic value for their health, and that's more where my job lies, is helping someone realize what keeps them motivated, and then it falls onto them. So that's the scariest part of healthcare, is making someone less passive and making them more active in their healthcare means maybe confronting about things that they've been more passive about. And it shouldn't come from a place of judgment, and it should never come from a place of, you can be doing better for yourself, so why aren't you? It comes from a place of working with someone to achieve the goals that they want. So realistically, making someone more motivated or keeping someone motivated is that's on them, really.
But I was thinking too, when you're saying realistic, having realistic goals that people can achieve and then realize, wait a minute, I can do this.
Yeah, you can't just say to someone, lose 50 pounds. And you can't just say to them, start eating vegetarian. Because, like, I'm not saying either of those are being prescribed in any specific instance, but as an example, when you just give someone a blind recommendation, they're not very likely to follow through. So you have to be, when you make a recommendation that's a treatment for healthcare, or you prescribe something that's for their treatment, you have to ask them, well, how likely are you willing to do this? Because I don't want to waste your time. And of course, like, me making this recommendation means that I'm investing in you as well. So I want to make sure that we come up with something together that works.
So maybe not French fries at every meal, maybe 3 times a summer.
Maybe. We'll see. I don't know. What type of patient are we talking about here?
Anyone, really.
Yeah.
The other thing that I've noticed is that pain seems to, with a lot of people who, I guess it's have chronic situations, pain is the hardest thing to manage or control.
Pain is a very complex condition, and depending on the origin of pain, it makes it more complex. Naturopathically, pain is very much an integrative medicine practice. Like, you need everyone on board in someone's healthcare field. Unfortunately, this adds a layer of complexity, because getting healthcare teams to work together or getting everyone having the accessibility for someone to access all the services they need is more complex. So naturopathically, we have to make our services both accessible and realistic for people. So unfortunately, pain requires time. So time both for you to recover and time for both you to go in for treatments, which is a huge barrier for a lot of people, because A, time is everyone's limiting factor, and B, finance is also a limiting factor. So unless you can get, physio that's covered by OHIP, or you get your, medications obviously are paid for by some type of prescription plan. And often people have benefits for acupuncture or massage therapy or physiotherapy that they can go to a private clinic for. And that's kind of the realm that we work in, right? So making our services accessible to people who don't have benefits and do have benefits, but also helping them treat their pain acutely often will make it better. But then it's, okay, now that we have your pain better, how do we keep it moving forward so you don't have the pain return?
And you were mentioning before that with knee pain, acupuncture can help with the acute pain, but then you're going to look at the bigger picture. Is someone carrying too much weight?
Exactly. So that's a great example. So once you get someone on board, you reduce their pain that they've experiencing long term, then it's like, okay, what is the organic source of this pain? Is it something that can be treated? Is it something that I can treat? Do I have to refer them? Do I have to now add another treatment to their mechanism, like weight loss or some type of anti-inflammatory or something like that? Are they currently taking that?
And there's organic pain and inorganic pain.
Yes.
What's the difference?
That's a good question. So all conditions can kind of be divided into organic versus inorganic causes, right? And those organic causes are things that we can measure. So for pain, what's causing your pain? Oh, you have inflammation. Do you have swelling? What caused it? Did you get hit? Were you in a car accident that caused, like,
Bit by a bee.
Bit by a bee, exactly. So those are all organic sources, because there's something that we can see, something we can measure. We can do a range of motion. We can do a blood test. We can do imaging, and they give us an image of pain. And then that can be reduced by treating the organic cause. And once we treat the organic cause, the pain reduces. Inorganic pain is more complex. So, and that comes from kind of the living with pain on a day-to-day basis, because often these people that live in pain on a day-to-day basis have their lives kind of being run by the pain. And then that in and of itself changes our perspective of life and changes our perspective of living.
And we're going to take another short break, and I would like to explore that a bit more when we come back. So please join us again. Welcome back to Sitting with Sallie. I am talking with Christopher Brown, a naturopathic doctor, and we were talking about inorganic pain. And while we were just waiting for a break, you said people are often told it's all in your head. And that's, I think, a lot of people, when the organic cause has disappeared or never was one, they're still seeking relief, and that's what they get told.
Yeah, and when a lot of people, when you're trying to identify a cause of pain, obviously pain is very complex in its nature. So a lot of people can not feel like they're getting a lot of help or a lot of relief from their pain, and that is very natural for most chronic pain cases. The important thing is what we do naturopathically and what we offer is kind of that emotional and a lot of that stress relief that you're not going to get regularly. So a big part of our focus, and a good example I like to give, is the book called When the Body Says No, written by Gabor Mate. And it's a great example of the life of a person who has lived a full life, and all of a sudden everything has changed. At one point, everything kind of stops in their life. And
Because of the pain. Because
because of the pain or because of something that can't be identified, and their body just begins to deteriorate. And at that moment, their body has basically told them, no, you can't go on any further because I'm tired, or I'm sore, or I haven't been given a break. And a lot of the people that live that life, and it's a lot of the time mostly women and mothers and people in caregiving positions, or people who have been giving their body to the world, basically, of all coming from all walks of life. And I think a lot of those people, when you're walking down that road where you're constantly giving yourself as well, right? So that inorganic pain can't be identified because it's being taken from you, and it leaves you kind of empty.
And it's like falling off a cliff, I think.
Yeah, so this inorganic pain that comes from like emotional damage or chronic fatigue and kind of stress can't be manifested in a physical test. So you have to kind of come at it from a non-physical perspective. So teaching people to become more in tune of what their body's asking of them is a big part of managing chronic pain. And a lot of people do this through referral to counseling, or referral to doing guided meditation, or talk groups, or social circles that are all dealing with the same thing. And in the literature, in the research, a lot of this has a very positive effect on pain, because once you are able to identify it and become more in tune with it instead of pushing it away, once you actually embrace it and realize that, oh, this is the thing right now, my body's saying no. So I have to learn to either back off or slow down or go in a different direction with it.
So what you're talking about is you have to look at some of the stresses that are placed on you emotionally as well as physically, and perhaps start dealing with some of the emotions and stresses in life that you said you've just sort of been able to plow through for so many years.
Exactly. Yeah. So helping someone become more active in kind of their pain management is a great way to manage pain. And of course, taking someone off medications should never be a priority if that is what's helping them manage their pain. But it's more working as a healthcare team.
But I think often people are taking medication and it reduces the pain. It's gone from a 9 to 10 to maybe a 6 or 7, but it's still with them every day. Mm-hmm. And it sounds like you work with them to try and get it from a 6 to 7 to maybe down to a 3 or 4.
Allegedly.
Allegedly.
Yes. So obviously pain management, there's not a lot of like high quality like research studies to say that complementary alternative medicine in adjunction to like Western medicine is good for pain reduction. But from a naturopathic perspective, pain management comes from a lifestyle orientation as well. So we're kind of going, like I said, that holistic approach where when you're looking at someone's pain, you have to look at the whole person. And like I said before, you have to see who they are as a person before you can just focus on the pain, because it's never just one-dimensional.
No, but it also sounds like the goal would be, rather than the pain being in control, the person gets back in control even if there's still pain. They learn how to manage and live with pain.
Exactly.
And that can't be an easy thing to do.
It's not.
No.
And often, like, people, you're never going to make someone with chronic pain have no pain. Maybe they'll have like lower pain throughout the week, or they'll have no pain for a day or two, or they'll have days that are better than not. And that is so common. So the biggest thing when you're having someone with chronic pain is helping them identify what's causing their pain so they can help decrease those moments more often. And then they go longer without having days where they're completely laid out. So when you do that with pain management, it's a huge win because then they can feel more in control, like they can do things they enjoy.
And what are some of the myths about naturopathic medicine that you would like to dispel?
Myths, I would like to just more state facts, like naturopathic medicine in terms of like in Ontario specifically, I'll talk about like we're under like the branch of regulated healthcare professionals of Ontario. Of course, we're licensed. Yeah. We have, so the word doctor in front of my title comes from the fact that I did, my undergrad at Lakehead University and then 4 years post-grad at the Canadian College of Naturopathic Medicine, where I have received the license to now practice naturopathic medicine under the College of Naturopaths of Ontario. That gives me access to do, so can I order like lab work? Yes, I can. So like your physician, I can order lab work. I can't order things like imaging or specific lab tests, things like prescribing. So in terms of what I can prescribe and what I can't prescribe, you're talking more natural remedies, right, as opposed to pharmaceuticals. So we do have to write a pharmacological exam. Like, are we educated in pharmacological stuff? Yes, obviously not the same as your pharmacist or as your physician, but that is part of our knowledge, right? Understanding kind of what is needed on all sides of the healthcare field.
And Little Oak Wellness Clinic is relatively new in Kenora.
Yeah. So the new center is new.
The new center, yes.
Yeah. So the owner of the clinic, Sindel Nab, has been a naturopath in town for just under 6 years now. And she just moved into this new building on Main Street. That is the new integrative health center that I now work at.
You now work at, yes.
Yeah.
Well, and how can people get in touch with you?
They can email the clinic at yourhealth@littleoakwellness.ca. We also have a website that's littleoakwellness.ca, and they can call our clinic at 468-9355 or 468-WELL.
Well, thank you for coming and talking about wellness and how people can do things to improve their health.
Thank you very much, Sallie.
My pleasure. Thank you for joining us, and please tune in next time.